At the edge of an international border, at the edge of the Pacific, at the edge of innovation, community, education, and discovery, you're listening to At the Edge of It All, a University of San Diego podcast where USD experts speak on topics and stories that impact you and the broader community.
Hi, thanks for joining us. I'm Lisette Martinez.
And I'm Elena Gomez. And with us today, we have Pedro Colio. He is a family and emergency nurse practitioner. He's also a clinical associate professor at the USD, University of San Diego, Hahn School of Nursing and Health Science. Pedro, thanks so much for joining us.
Superman, I'd like to say.
Thank you so much for having me. It's a pleasure to be here.
We kind of want to dive in a little bit more about your journey, how you got to where you are now as a professor and as someone that is a nurse practitioner. What inspired this journey of getting into nursing?
Actually, I didn't have an inspiration to become a nurse when I graduated high school. I kind of wanted to just be a tractor mechanic because that's all I saw where I lived. I lived in Imperial County. There's a lot of farming. When I graduated high school, my mother told me, you need to go to college. So I enrolled to the community college, and I saw what my options were. So emergency medical technician, water treatment, and there was nursing available. But I saw that it was a little bit unattainable because my English wasn't that great. So I came from Mexicali when I was a sophomore in high school. And I'm a U.S. citizen, but my parents had jobs that they were not that great, so we had to live across the border in order to afford a home. So my parents enrolled me in school in Mexico. So later on, we moved to the States when my dad had a little better job, and I started college and high school, and then started college. So I didn't think that nursing was for me because it required a lot of education, anatomy, physiology, a lot of English on my part. So I kind of saw it as an unattainable goal, but my mom persisted that I go to college, so I'll go for nursing. And gradually I started getting better, and I took an EMT course, and I saw that, I really like this emergency stuff. So I saw other people like myself that were being successful, and I thought, if they can do it, I definitely can. I learned English in 1 year. And I figured my grammar wasn't great, but my language was fine. And believe it or not, I learned English by skateboarding.
Oh, how so? Wow. How did that happen?
Yeah.
So playing video games, of course, but I would skate a lot in a city called Brawley. Brawley is farmer town, but there's a lot of, I don't know if I'm saying this correctly, white people, and they were the ones that would skateboard. So I would hang out with them, and I would kind of like do sign language. And sometimes I would get a little bullied, but not physically bullied, just made fun of because the way I would pronounce words. But then I saw that I kicked butt skateboarding. I could do all the kick flips, the hill flips, everything. So they started hanging out with me because they knew I could skateboard.
You got that respect.
Yeah, so I picked it up skateboarding with them. And then I became their friend, and next thing you know, I was fluent. I couldn't write it though.
But you can speak it very well, and that's what got you going in the nursing track. But if I remember correctly, when I spoke with you once, you told me that your grandma really inspired you to become a nurse, right?
That is correct. So right after high school, my grandmother was very sick. She was in dialysis. She had diabetes, hypertension, typical things you see in the Imperial County because the quality of care is not that it's poor, but it's an underserved community, and there's not a lot of physicians and nurse practitioners and PAs. So we would take care of my grandma. She had diabetes, so I would help with her medications, putting them in the little cabinets for her. I would help her checking her blood sugar and giving her insulin injections. And on a few times, I had to call 911 because her blood sugar was so low or so high, and she had altered mental status, so she was a little delirious. And that kind of, gave me an inclination to, I'm kind of good at this.
Right.
So my grandma also, you're going to be my doctor someday. And I just kind of like brush it off, like maybe a nurse or an EMT.
Right. How old were you at the time?
When I started taking care of her, very young, probably 12. But later on, when I became more involved with her care, probably around 19 years old.
Yeah.
How did that influence does that stick with you today when you're with people, when you think about the people that you help out in the Imperial Valley? Does that kind of still all tie in with you of the people you meet, it's like you've taken care of your grandmother, but it's someone else's family member. Does that kind of stick with you, I guess, when you're in a career that's service oriented and helping people?
Definitely. At the time, I didn't see it, but now when I'm taking care of geriatric patients or patients with the same condition as my grandmother, I remember how naive she was to those things, because she would go to the doctor would only speak English to her, be with her for like 5 minutes and send her out, and we had to figure out her meds. So I remember the situation that we were in. So now when I'm taking care of patients, I remember that clearly, and I explain things to patients in Spanish. I spend the time to write things down for them. And I remember how vulnerable my grandmother was. Without her help, she would have died probably years before, she did. So I put myself in the, patient's shoes. If that was my grandmother, I would have wanted this for her. And that definitely influenced me.
I know that you have also talked about the reason why you worked still to this day with underserved communities, and including in the area where you grew up in, right? It's such an important part of what you wanted to do in your profession.
Definitely. There's definitely certain motives of why I stay in the Imperial County to work. Number one, I love taking care of patients of my same background, Hispanic patients. I feel like I can, I feel myself that I'm doing the right thing, and I can assimilate to what they're going through. And I love taking care of patients that, speak Spanish only. But the reason I stay is for, I like being near my family. And I think that I'm making a change. So if I worked here in San Diego area, I feel like I would just be another nurse practitioner, not really making a change. I would just be like another person there. And in Imperial County, I can definitely make a change. I see tons of patients over there, more than I would see here. My regular day at a cardiology office is anywhere between 35 to 45 patients. And, my days are long, but at the end of the day, I feel like I accomplished something. I feel like I did something good. I don't see it as a job anymore. It's more of a hobby for me, a career. I really enjoy it. And yes, I would love to live in San Diego. I love the weather here. And, if my wife said, let's go, I would come. But the thing is that I would probably still work in Imperial County and commute. And my autonomy as a nurse practitioner is greater in the Imperial County than it would be here. And that's because of the shortage of providers.
And that's something very important to touch on, because you have told me in the past when we've had conversations about this issue, and you briefly mentioned it now, that there was never growing up enough doctors or specialists in your area, right? I think you discussed with me that people sometimes had to drive all the way to San Diego or to other places to get that specialized care, and it's not even in the playing field for people who are sick, who need attention.
And that is correct. And in Imperial County, the emergency services are overutilized because of the lack of primary care physicians. And while we have plenty of nurse practitioners and PAs doing primary care and internal medicine, we don't have a lot of orthopedists. We don't have a lot of cardiologists. We don't have a lot of, actually endocrinologists, we only have one for a place where probably 60% of the population, geriatric population, has diabetes. We only have one endocrinologist, and she's very selective of her patients because she wants to provide the best care she can, and she's doing the right thing, but we need more endocrinologists. So that's another reason why I stay there. I work in a cardiology office in the emergency room, so I'm seeing both aspects of this. So a lot of the patients I see in cardiology, I also see them in the emergency room for other treatments, and they always try to nudge me, hey, so here in the emergency room, you can treat me for my sprained ankle and my high blood sugar, but when you see me in cardiology, you only want to touch my cardiology stuff. So the patients have like a little bit of role confusion because I'm in two aspects of medicine. But I stay there because of that same reason. I don't think of any other place where I would be able to do both.
And that kind of ties into some of the research you did recently in the Imperial Valley based on the impacts of COVID in that region. What did you find in this region based on some of the research you did?
So my research study was on the cardiology implications of COVID-19, specifically looking at conditions like a heart attack, myocardial infarction, inflammatory heart disease. If you remember, there was a big fuss with the COVID-19 vaccine. People are getting pericarditis and myocarditis, and people were hesitant for the vaccine. So I thought this is a great opportunity to look at an underserved community that was highly impacted for COVID. We're shipping patients everywhere. Let's see if all those things they're saying, they're true. So my study started somewhere in early 2020 and ended somewhere around 2022. My sample wasn't that great, but I was able to capture a good number of patients. And what we found, specifically what we're looking at, the cardiology implications and pandemic implications, two different things. Cardiology implications would be, I got COVID and I ended up with this heart disease, or I ended up with COVID, and because of the pandemic, my standard of care was not met. So yes, we did find that COVID-19 impacted patients with atrial fibrillation, which are arrhythmias. But one of the things that really caught my attention was the ones who were not COVID positive, the standard of care was not met. So COVID-19s would come with aggressive symptoms. So physicians, nurse practitioners, nurses were on top of them, treating them, shipping them where they needed to be. But some of the ones that didn't have COVID, their healthcare was impacted. Their care was delayed. The transfers were delayed. And yes, COVID did cause some heart disease, but no, we did not see a lot of pericarditis, myocarditis. We had a lot of patients with the vaccine in the study that didn't have that. Some patients would come in and suggest, I'm having this, but the studies ended up showing that they didn't have the condition. But ultimately, COVID really impacted the Imperial County, and not necessarily just from the COVID-19, but just the pandemic itself, of how the care was delayed and how impacted the ER was. Typically, if you come in for one condition that we deemed acute and needs to be admitted, during times of COVID, we're like, well, it's not so bad. Go home.
Right. And I know that this is continued research that you're working on, but let's touch a little bit on another aspect of your life, because like I said, you're like Superman. You are doing a million things at once, right? We just discussed your life as a doctor. As a nurse, a doctor. Well, you are a doctor, actually, a doctor of nursing.
I have two doctorates, PhD and DMP.
Exactly. And that's what I want to get into, right? Those doctorates and your continued education, right? Talk to us about why you wanted to teach at one of the universities where you were a student once, and now you're teaching students who also are from the same area that you came from, and you've talked to me in the past about the importance of that to you.
Frankly, I never thought about becoming a teacher as I was growing up. I did my bachelor's degree in nursing, then I came and did my nurse practitioner, which is a master's degree. When I graduated, I just need to find a job. I have a master's. There's a job opportunity at a community college. I'm just going to apply while I find a nurse practitioner job. So I applied at the community college and went for an interview, which was kind of intense. They had me lecture something. And I remember my audience were English teachers, PE teachers, and they wanted me to teach something in nursing. And I was like, what can I teach that everybody can relate,
right,
who don't understand healthcare? So I focused something on women's health. And I think that what really attracted them was that the way I was able to deliver the content in a sense that was, understandable to people who are not in the field. So I started doing that in the nurse practitioner, and, I found like I'm good at this, and I don't like to brag about myself, but I felt like I was okay at it in teaching nurses who were mostly Hispanic in Imperial County. And then I decided, let's do the doctorate degree at USD. And I met one of the teachers here, faculty, and I told her, hey, I teach a little bit at the community college. Would you need, some help, teaching here at graduate school in your pharmacology class? And, I can come in. And sure enough, she's like, oh, you want to teach? Sure. Come in and you can do a guest lecture. And I had really good reviews by these graduate students. Typically, it's really hard to impress graduate students.
Right, and difficult audience.
Yeah, graduate nurses. So that turned into a, part-time job here at the community college, and the, former director, she kind of become fond of me, and she's like, we need this guy. And so I was like, let's do it. It's going to be a challenge, because fitting the shoes of a professor at a 4-year college is a lot different than the community college. So that's how I ended up here at the University of San Diego. It was never a plan. It just, appeared out of nowhere, because I just continued to go to school. And do you know why I kept going to school?
Why?
Not because I want to be this huge scientist and researcher, which I do love doing that.
Correct.
But I remember looking at the statistics from nursing books and online, and it says like there's hardly any males, and with a PhD in nursing, specifically Hispanics. So I was like, I want to be that 0.001% of nurse Hispanics with a PhD. It's not only just in nursing though. Like how many Hispanic, males or Latino males do you know that they have a PhD? Right. So that was kind of an accomplishment for myself to do that. And along the way, I fell in love with it, and I love research, and I'm trying to get better at it. It's difficult, to try to balance these things, but research is what gets you going.
Right. And to finalize this conversation, I think it's not only just a checking of the box, right? Oh, you're Hispanic and you are a male. You really do have a passion for this and for advocating for more people of color to be in nursing. And I know that it is a priority for this School of Nursing at USD and many schools of nursing across the country because they are really needed. It's so important to find physicians. And I think about that myself when I'm looking for a doctor or a nurse to go talk to about anything in my life, that somebody that can relate to my background, that knows where I come from, maybe even speak the same language I do in my household with my extended family. It is very important.
So what you're referring to, it's health equity.
Correct.
So health equity it's a big deal, and we're trying to include it in all schools of nursing. Not everybody receives the same care, and you may think it's not a racist thing. It's just where you live, and it is not a racist thing. But why is funding for healthcare going to bigger cities? Why are hospitals being built in places like La Jolla? Yeah, they're nice, and there's a population, but there's other places that have large minority groups, large populations, and there's no funding, there's no grant and budget going to these hospitals. So as nurses, we saw that there's a need for, teach people about health equity and how we can improve it. So here at the university, we decided we need people of minority groups to be faculty because typically minorities end up working in areas where, they grew up. So like myself, like I said, grew up in Imperial County, and I have every opportunity to live in San Diego, and I choose not to. I'm still living down there because I enjoy it. That's where I grew up. So if we have more faculty that can teach how to take care of minorities, the difficulties that we go through, how we manage to deal with, insurances and get the medications approved for patients that don't have the fancy HMOs and PPOs, and then they're just on straight Medi-Cal. That's why we need those faculty, and we can help improve health equity by hiring more faculty of minority groups, Hispanics, Latinos, African Americans, anything, because they bring a different value. They bring cultural things that we may not be teaching the students. So like myself, I teach the student, this is how I manage patients in El Centro, but maybe this is not the way you would manage patients here. Right. And nurse practitioners and physicians assistants, if they want a job, they will find it in underserved communities. And also they need to understand that where you're needed, your income's going to be a little bit higher as well. If you work in an area where you're not needed that much because the place is beautiful, expect that you're not going to get, paid as much. But that's not really the point here. The point here is have minority instructors teaching students, and that's going to attract more minority groups. I can do that too, and I want to work in a place like this, and we're going to improve health equity.
Well, I definitely have such great respect for nurses of all backgrounds, especially as we saw how incredibly important they were during that pandemic. Thank you so much for this wonderful conversation, and remember to subscribe to our podcast so you can catch our next episode.